Greetings, everybody. I'm Dr. Aditi Mohta, Assistant Professor of Community Medicine, currently based in India. Today, I'll give you an overview about adult learning in the context of medical education, and I hope that you find it useful as early educators and learners. So, isn't this quote very appropriate that education is not just about the teaching, pouring knowledge into the brain vessel of a student, but it's also about lighting a fire, igniting curiosity, encouraging self-directed learning, and in fact, lifelong learning in that learner. Earlier, it was believed that a teacher or an educator is an oracle, a repository of knowledge, and that the teacher has to transmit the knowledge to the student. But now it is believed that the role is more that of a facilitator, that they can act as procedural guide. They can serve as the source from which the students get to know about the resources. They can improve the resource accessibility, and they can also join learners in their learning process as a co-learner. So now the power dynamics or the authority status that changes a bit, and that is why good subject knowledge is not equivalent to good teaching. So good teaching actually is a process of guided interaction between the teacher, the learner, and the materials of instruction. And it is not limited to the subject content alone. The role of the teacher now, since it is that of a facilitator, subject content alone would not suffice. There has to be intent, good delivery style, genuine interest in the learning of the learner, and that actually should translate into a change in behavior. That is the whole objective of learning. So subject knowledge alone would not suffice. All these components also have to be there. Adults learn differently than children. This is the whole premise of andragogy. So Dr. Malcolm Knowles had introduced this term andragogy, that is the art and science of helping adults learn, and that of helping children learn is called pedagogy. Now, it is not that everything is extremely different or they are polar opposites of each other, but it does matter that a few learning principles that are very specifically helpful for adults will be useful in this andragogical process. So let's have a look at the principles that Dr. Knowles gave us. The book name is also mentioned in the references along with all the other references. The first is self-concept. Adults are self-directing. Self-directing as in terms of their initiative that they take, or the initiative that they have to take in planning, in assessment, in the course design, in content development. So they direct their own learning. Let's compare it with how we used to learn in school. So a lot of the curriculum, it was structured in a way that you have this time slot for this particular subject. It would go on for a year. Maybe you have every subject every day, and there is a set sequence of chapters that has to be done, usually in serial order, and very little questioning. So students were mostly absorbers, and the teacher was the transmitter, and the teacher was clearly in the authority position. Also, children did not have questions in the sense that why should I learn this? In fact, it was difficult to ask such questions. In case of adult learning, the learner may, in fact, even be elder to you in age or even be more experienced in some aspects. And that is why it is important to incorporate these principles. That the first thing is that they are self directing, then they bring prior experience by virtue of their job experience or, in fact, by their age themselves. Then the readiness to learn is usually based on need. The need could be anything. It could be a problem that they are facing because of which they need to learn something, or it could be an external issue, such as a promotion, which is also covered in motivation. Then there's orientation to learning, which is usually problem oriented, or in case of medical education, it could be clinical case oriented learning. Then motivation is usually internal. So though external motivators could be there, like promotions and salary hikes, but for it to be sustainable in the long run, motivation has to be internal, because only then somebody can prioritize learning over the other things which keep happening in life. And that motivation could be related to an increase in self confidence, or it could be related to increase in self esteem, or just wanting to learn more about that topic. And then there is need to know. Adults usually need to know why they are learning something. And if they are not convinced enough, then they may decide not to learn that thing. These principles can be used even if you are assuming the role of a learner instead of that of an educator. So let's have a look and reflect. Reflect for 10 to 15 seconds. How do your current learning habits align with the principles of adult learning? So, for example, what is your reading priority right now? Why is it a priority? Let's have a look again at the previous slide. Now, try to align those things in this framework. So, maybe something is a reading priority because you saw a case in the OPD, or somebody asked you a question, or you just remembered that you should know more about this thing, and that is why you're back at that topic. So now I'll discuss the process elements of andragogy. If adult learning is a process, then in that process, first we have to prepare learners, provide information, set their expectations for the upcoming learning sessions. The climate should be mutually respectful, collaborative, informal, and trusting. It cannot have that element of absolute authority. Otherwise, it is difficult for adults to adjust to it. The planning of the course, the learning contents, it should be mutual. The diagnosis of needs, that is mutual, and formulation of objectives for that learning material, the course is also going to be mutual. Designing learning plans is usually according to readiness of the learner. It is not a set sequence in terms of number of hours that something has been done, it has been allotted 3 hours. So you can have a framework, but actually, is the learner ready? Do they have background knowledge about that topic? Are they ready to, have they already solved the simpler problem that they can move on to the complex problem? So that is how learning plans should be designed. The learning activities largely experiential and inquiry based, and evaluation should also be mutual. The Even if the learning needs have to be re-diagnosed and another program has to be started, something has to be taken up again. um, End assessment, summative assessment, that also should be based on uh, mutual discussion. So if you notice, most of these aspects of adult learning are mutually based, so you have to take the adult learning factor into account. In case of pedagogy, a lot of these things are decided by the teacher, and there's very little role of the learner. Let's have a look at a few adult learning techniques. This list is not exhaustive. Experiential learning. So, the learning that we routinely encounter in clinics and community, that is experiential. The next is self directed learning. SDL does not mean leave the student in the library for an hour. Actually, SDL is supposed to be guided, that they should know the objective of that session. Then you can, as an educator, you can direct them to some useful resources. Then they learn by themselves, and they should also be either assessed, or at least a discussion or a reflection session should be there, so that their whether their learning requirements were met or not, those can be assessed, and then re-diagnosis of needs can be done. Then there is problem based and case based learning. So in PBL, usually there is an open inquiry and minimal pre reading, and we focus on developing problem solving skills and self directed learning strategies. In case based learning, there's a little pre reading and a more guided inquiry, and the learners are focused on applying newly acquired knowledge to specific clinical cases. Both of them start with problems or cases. And if you see, they are aligned to our previous principles that have been discussed. So it will evoke the need in them to learn that. It will be problem oriented, and that is why it is more likely to engage learners. Then there's reflection and feedback that should be incorporated in adult learning. There are multiple models, reflective cycles. uh, Journaling can also be used, and then it should also receive a feedback so that the learner improves on the reflection techniques. It could be based on something like what exactly happened, what are the consequences, implications, what does it translate into, and then what can be done to alleviate it or improve it, or what next can be done. A few teaching techniques here, on the job teaching. So, learning directly in the clinical environment is a part of this. Then, techniques in which the facilitator role is adopted by the educator. For example, problem based learning, group discussion, case based learning. Then there's interactive lectures. In think, pair, share can be used, in which students think on whatever probe you have given them, then they pair and discuss their ideas and then share with the entire classroom. Technology can be used. The lecture could be broken into smaller segments so that they're able to rejuvenate and then refocus on your problem. And then, of course, there's the traditional role modeling, in which you observe trainers as role models. So let's see how it can be applied in UG education. For example, in pharmacology, if the learner wants to learn about anti-cancer drugs. Now, this is a complex and extensive topic, and it includes mechanisms, side effects, clinical applications. So in this case, there could be problem-based self-directed learning, maybe a clinical problem related to anti-cancer drugs, and self-directed learning to understand that topic. Experiential learning and digital platforms. So here the students could be asked to find and observe and interact with cancer patients, maybe in the wards or the outpatient department or community setting. They could even read further about it. They could share texts or videos, involve technology, which is a part of utagogy, and use mobile phones for interactive learning. Then such techniques would involve that problem orientedness, that need to know, and motivation. The internal motivation could be elicited here. In case of community medicine, for example, managing patients with limited access to specialists or dealing with emergencies in remote areas. So, immersive placements in rural healthcare environments could help here. Problem based learning, team based learning, weekly case discussions, active learning methods in tutorials, and integrate self learning methods in these things, provide them, direct them towards good resources. Then, in attitude, ethics, and communication modules, breaking bad news, navigating ethical challenges, demonstrating professional behavior, you must be familiar about the role plays that we often have. Apart from that, standardized patients could also be used, and self reflection and deliberation and feedback could happen. Then there's case based discussion or vignettes that can be used to guide the discussion. So, apart from UG subjects, if we want to apply these things in residency, if you have postgraduate residents, so I'll take a few examples here. For example, if in community medicine, the resident has to understand community health needs of a specific local community. So, the principles that you could utilize are problem centeredness, utilizing their own previous experiences in the community, and readiness to learn. Techniques could be problem area or oriented learning, self-directed learning, case-based learning. In fact, engaging in discussions, interviewing community health workers, tagging along with them, and reflecting on those challenges and whatever experiences that they gained in the community. In case of general medicine, if a resident is managing a patient with a complex multi-system disease, where the current guidelines seem insufficient. So uh, there could be a case-based discussion with seniors or experts. There could be review of literature, even participation in a journal club. and facilitated discussions with senior residents, with faculty, reflecting on the existing diagnostic and management uncertainties. These things can be done. In obs and gynae, if a resident is learning a new surgical procedure with high stakes, so in that case, there could be simulation or practice models prior to actual practice, to actual dealing with the patient doing the procedure. Then there could be performing under supervision and structured feedback on the resident's performance, and also modeling can be applied here. In case of psychiatry, developing empathetic communication, those principles of ADCOM can be used here also. And additionally, reflection on interview transcripts and video recordings can also be done, and perspectives of the patient can be discussed. In pediatrics, translating new guidelines into practice. So here, self-directed learning can be used to review the guidelines and supporting evidence, and a facilitated group discussion can be carried out. Again, problem solving and case-based learning is can be very useful in all these clinical settings. Now, no matter what we do in UG or PG education, we have to tailor the learning experience as far as possible according to the learner characteristics that would optimize their engagement. So it depends on the learner's life stage, how experienced they are, what uh, the past experiences, the degree of autonomy that is demonstrated by that learner, and the preferred learning style. Everybody does not learn the same way, and not everybody prefers it. Not everybody is enough engaged. They may or may not convey to you, but you'll see that in their performance. You may even become an educator who's, guiding somebody for a PhD, for someone who is elder to you. So those things have to be taken into account. They may bring their own prior experience from workplace, and it can be used to. Those things can be used to leverage those opportunities. The learner can do even better with that kind of experience. With that, I'd like to. I urge you to reflect again for 10 to 15 seconds. Based on whatever we have discussed so far, what is one small change that struck you and that you could make in your teaching approach based on these principles? So I hope you found something of use to you. To summarize, adults learn differently. Key principles are based on self concept, experience, readiness, orientation, motivation, and need to know. And effective teaching learning methods align with these principles. These are the references. You could immerse into them for further reading. And I want to tell here that, I hope you apply these things. You find them, you find some guidance in whatever you learned today. And I hope that I've always had that feeling to become the teacher that I've never had, or, to do even better, and to you could someday be an inspiration for other people to take up your branch, or the reason why a learner remembers key concepts of your subject, even if they don't take this up. Because, the things, even when we learn in undergraduation, we tend to remember all those things. So I hope that you'll use these principles, and the learners benefit, and you yourself as a learner can also benefit. Thank you.